welcome to Soda City Unleashed, where we decode pet health with the best vets in Columbia, South Carolina. Today, we have one of SeeVets neurologists, Dr. Kendra Bohn, with us. Dr. Bohn, welcome. Tell us about yourself.
Hi, I'm a veterinary neurologist. So what that means is I went through a residency in neurology to specialize in caring for dogs and cats with things like spinal cord or brain issues like seizures or brain tumors.
That's awesome. And how long, where did you go to school and how long have you been practicing?
I went to vet school at The Ohio State University and then did an internship at Auburn University, a second internship in neurology specific at Gulf Coast, and then my residency at Tufts in Boston, Massachusetts. Since then, that was in 2012 that I finished my residency and passed my boards and worked for 7 years in Pittsburgh before coming to Columbia, South Carolina, where I love it here, about 6 years ago.
Awesome. And did you have like the little girl moment where you always wanted to be a veterinarian, or did you
ridiculously, yes.
Yeah.
So my mom actually really jokes that I went from wanting to be an ice skating queen, and keep in mind, I took ice skating lessons when I was 6, to wanting to be a veterinarian and never looked back. Like, I was the little kid with the veterinary stethoscope and my little dog with the little wraps, my stuffed animal dog. That was me. Like, I literally never changed my career path from there. So 6 years old.
It's incredible. Do you regret it?
No.
That's awesome.
No, it was, I think veterinary medicine is a little bit of a calling for people. And, it definitely was like my path. I'm a healing type person. I want to fix and make everything better. And, I just love the animals. So it was the exact perfect fit for me.
And I guess you get to see that, seeing the actual healing in the neurology department, because a dog comes in with epilepsy and you're able to help correct that and fix it and see results. That's probably pretty cool, right?
Yeah. The disc ruptures are probably the most instant gratification, because you have a dog that's ruptured a disc in their back and they're completely paralyzed, and you go in and you do surgery and they come back for their 1 month recheck and you can barely keep them from running around, 95% of the time. And so it's really cool to see that really fast change. On the flip side, the epileptics are really nice because you actually form these relationships and bonds with patients that you see for years. I've got some really lovely owners that I keep up with even after their pets have passed on, that I've met through treating their pet.
That's really awesome. Okay, so coming from a neurology viewpoint, what are your top 3 pieces of advice for pet owners?
So probably my top 3 pieces of advice are going to be, first, if you're able to, this one's a trickier one, when you have a puppy and it's a small breed dog, especially like a dachshund or a French bulldog, one that's prone to disc issues, I would recommend trying to teach them to use stairs to get on and off of furniture rather than encouraging them to take those flying leap jumps. Just decreases the wear and tear on their back. Even more important than stairs, though, is keeping them at a nice trim weight. So, you add that extra weight and you're adding extra wear and tear to their joints. Now, I wouldn't restrict their activity because movement is good for the discs. So, having them running in the backyard and playing with their buddies, that's actually really good because those discs are acting like shock absorbers, and that's bringing our good nutrients into the disc to keep it healthy and well hydrated. And then my last piece of advice is not really related to discs, but just in general, when you have something that's episodic, so seizures are what I see most often, but there are a few other weird episodic things, a picture is worth 1,000 words. So grabbing a video of that so that your vet or I can see exactly what they're doing. A cat, for example, is really nervous at the hospital and they're having walking problems at home. They might not even want to walk. They might want to be all curled up in a little scared ball. And so getting some video of them walking around the house so that you can really appreciate what they're doing can be super helpful for me.
That's so interesting. I've never thought of that before. I feel like I've brought my dog Biscuit to the vet before and been like, I swear he was doing this at home, you know, but of course, you know, they're in a situation where they're anxious and they don't.
Their adrenaline. So dogs that are painful at home and yelping might not react at all here because their adrenaline is up flying high. And so they might not tell me where it hurts. I had a dog that I treated, this was way back in my residency, but it was a police dog. So like you're talking about the most stoic possible dog. And this one was on the aggressive end of police dogs where it was very hard for us to handle. And we did an MRI on the dog based on the video of its back muscles rippling and its handler saying it's not performing at its top level. I think this dog is in pain. And you could see like back spasms in the video. It's all we had to go on. And it ended up having an infection of its disc spaces.
Oh my goodness.
And it was treated and it did fabulous. But our exam was, the dog was just too stoic and too amped up for us to tell anything on its exam. And it wasn't, it wasn't stumbling or knuckling or anything like that would be big and obvious. It was just pain. So that was one situation where a video just totally saved the day.
Wow. But that's one of the perks of working at a veterinary hospital. If there's anything wrong with my dog, I take like a quick picture and I'll go to any of the different specialties and be like, what do you think about this?
Well, and that's one of the perks of SeeVets too, is like we've got really great communications between departments. And so if I have a patient that comes in or my own dog, I can just walk down the hall and be like, hey, Dr. Haviland, hey, Dr. Wolf, can you take a peek at this? This is in your world. And the rapport between departments is amazing. So that's one of my favorite parts of working at SeeVets.
That's awesome. Okay, so one of the things we want to do with this podcast is kind of decode and not simplify, but explain some of these things that, as a veterinarian, you totally understand and talk about every day, but maybe like the general public wouldn't know. So tell me about, like, when you're talking about discs and when you're talking about discs in smaller dogs primarily, what are we talking about? We're talking about like the spinal cord and like the individual things there. Will you just like give me a rundown on that?
Yeah. So discs are our little spacers between the vertebrae, and the vertebrae are the bones that protect our spinal cord. Discs should be made kind of like jelly donuts, a fibrous outer layer and a soft, squishy, gelatinous middle. In certain breeds of dogs, so dachshunds with their long back and their short little legs, those discs are a little different. They're prone to degeneration. So they have some genetic predispositions to becoming hard, not acting like shock absorbers anymore. So now that middle part that's no longer soft and squishy, it's hard, in normal day-to-day activities is prone to popping out of place. When that happens, it squeezes the spinal cord and causes any range of signs from a dog that's just painful all the way to a dog that's completely paralyzed, or if it's even worse yet, no feeling to their back legs. We want to catch them before they get to that point of no feeling, because once we've lost feeling, there's a chance of irreparable damage to the spinal cord. The prognosis or chance for them to return to walking again when they've gotten all the way to no feeling is only 50%. If we catch them before that, when they still have feeling in their legs, they have about a 90% chance of getting back on their feet, back to running and playing and doing everything they love doing again. Dachshunds have about a 20% risk of having a disc rupture just by being a dachshund, just genetically. And really any small breed dog is at risk. It happens in large breed dogs too, but I'd say that dachshunds and French bulldogs are my top breeds. In the large breed dogs, it's probably going to be German Shepherds as my number one and Pit Bulls as my number two. But those are still by far much less common than the small breed dogs.
So say there's a disc rupture or that there's degeneration.
Degeneration.
Okay. What is the next step? What do you do to help the dog?
Yeah, so a lot of times we'll do an x-ray to make sure there's not anything else going on, because there's other possibilities. So disc rupture is one thing that can affect the spinal cord, but we can see infections, autoimmune diseases, tumors, fractures. There's a disease in some breeds of dogs that's kind of like ALS in people, Lou Gehrig's disease, called degenerative myelopathy. And so, an x-ray can start by looking at the vertebrae and looking at the space between the discs, discs, looking for any bone tumors, any fractures, anything like that. It can also help us choose that next step. So in a younger dog, if we have a calcified disc on that, that's just one of the ways the disc can degenerate is calcifying. That calcified disc material will show up on a CT scan, which is faster, less time under anesthesia. On the other hand, if we don't have that calcified disc, or if they're older than, say, 6 years old, we're better off doing an MRI that's going to be a lot more all-inclusive. The CT scan only shows the calcified disc material and the bones and stuff like that, whereas this MRI is going to show us the spinal cord, any disc issues, and a lot of the other information like tumors that we probably wouldn't catch on the MRI or on the CT scan.
Gotcha. And then inevitably, if it's something you think you can fix, you'll go into surgery. Is that right?
Yep. So if it's a disc rupture, then often under that same anesthesia that they have for their imaging, we talk with the owner, explain what we found, and go forward with the surgery under that same anesthesia. And what we do with that surgery is we drill a little tiny hole into the bone over where that disc material is located and reach in with teeny tiny hooked instruments to gently and carefully pull that disc material out, give the spinal cord the space it needs for healing. There's still going to be bruising and inflammation in there, so it's not an instant fix, but it's usually 2 weeks on average for them to return to walking again. And full extent of recovery can take 6 to 9 months, but like I had said earlier, usually by that end of the 1 month of rest, they're wanting to go, feeling pretty good, pretty mobile, just still some fishtailing and in coordination.
So when you're in the operating room, is that the surgery that you're mostly doing?
That's my most common surgery by far, is a disc rupture, and more often in the back, although they can also have discs in their neck. I also do brain surgeries, tumor removals, placements of shunts, which is where, if you've got something called hydrocephalus, too much water on their brain, you can place a little tube from their brain down to their belly with a little valve that regulates that pressure to keep that pressure from building up in their brain from overproduction of spinal fluid and decreased absorption, and allow them to lead a more normal life.
Wow, that's incredible. You heard that right. Brain surgery. We do brain surgery on pets. Incredible. Cool. Okay, well, let's get to some more fun, although health is fun. We love education. What is the funniest thing that's ever happened to you as a veterinarian?
So I thought of two things. One was just a funny patient situation, which is there was one day that I had literally my biggest patient and my smallest patient in hospital at the same time. So my smallest patient was a little chihuahua that had an atlantoaxial luxation. That's where the first and second vertebrae in their neck are not attached properly. This dog was 3 pounds, and I had to do surgery on it to fuse. So I put implants in, screws and bone cement to fuse those two vertebrae together to stop them from being too loose and squeezing on the spinal cord.
Wow.
At the same time, I had a Great Dane. This kiddo was a big Great Dane too, about 150 pounds. And had something called wobbler's disease, which is where they overproduce bone and that kind of squeezes on the spinal cord. And so I remember we took a picture of both of them together, the Great Dane and me holding the little chihuahua, and it was adorable.
That chihuahua could have been the Great Dane's play toy at home.
Yes, it was smaller than probably any of the Great Dane's toys at home.
Oh my goodness. What are the odds, right?
Now, my dog is obsessed with little toys, so it's about little toy size for my dog.
Wow.
The other funny story was actually pre-vet school, but it still is cemented in my memory. So I worked at a equine hospital, and with horses can't throw up. So you have to, if they have a stomach ache, you have to pass a tube down from their nose down their throat into their belly. But in order to get the fluid out of their stomach that's built up, you have to kind of start the suction. So you have to suck on the tube a little bit. And sometimes you're just not quite fast enough at getting out of the way. And I got a mouthful of reflux, and it was so disgusting.
Oh my goodness. So okay, I'm recreating this in my mind.
Yes.
Tube down a horse's throat.
Yep.
You're literally have your mouth on the tube, sucking it to get it started.
To get negative pressure to get it started flowing out.
And it came back into your mouth.
Oh, yes.
Oh. Oh. It reminds me of like when you have a baby and you're like holding the baby up and it like vomits into your mouth. But this is a horse.
Yeah.
Wow.
But I honestly, I'm less grossed out by the horse.
Really? I love that for you. I love that for you.
I never had a baby. So I started, my stepdaughter is 14 when I first met her, and now she's 19. And
you never had to deal with all that
the
nasty stuff.
Didn't have to deal with diapers. I don't know what to do with babies.
So you just deal with horses and their reflux.
I don't mind dogs, cats. Dogs can poop on me. That's okay. I just don't know what to do with
small
babies.
child.
It's not
Does
really
anyone really though?
It's not a dislike. It's like it's a fear.
Yes, I feel that. I definitely understand that. Okay, what's the most memorable experience you've had as a veterinarian?
Probably my most memorable case as a veterinarian was a dog that I treated that had a hematoma in its brain. It probably, although dogs are so small that we weren't able to diagnose it, but it probably had a burst aneurysm.
Can you explain a hematoma?
Yes. I'm going to.
You're getting there. You're getting there. Okay, I'll be patient.
So, an aneurysm, first of all, is a blood vessel with a little bleb in it, a little weak spot. Okay. And that bleb, as the blood is pumping through, is prone to bursting. And that results in a little bleed in the brain. But the problem is the brain is encased in the skull. There's no extra space for anything beyond the brain, the spinal fluid, and the blood vessels. So you add anything to it, in this case, a blood clot, and there's no extra additional space for it. And so I had to go in and do surgery and get that blood clot, that hematoma out of the brain because it was squeezing. It was a very small dog, a chihuahua.
Oh,
and while the bleed was only probably about 1 centimeter, the dog's brain is only a couple of centimeters. And so it was taking up substantial space in this dog's brain. And so I went in, I removed the blood clot, I stopped the bleeding, and this dog did amazing. It went from being comatose,
wow.
It could not stand, it could not walk, to after it healed, back to a normal quality of life. And actually I kept up with her owner for years afterward. And unfortunately she's passed away now. That was probably about 2 years ago that she passed away. But it was just so cool.
Gratifying to be able to, again, that instant gratification of like, completely in pain or not even in pain.
Yeah, I mean, we almost lost this dog.
Wow.
I mean, if any more bleeding, and it would have squeezed on the back part of the brain, on the breathing centers, and we would have lost her. I mean, she was that close.
When you're in a Chihuahua's brain, we're talking a couple centimeters, like you said. Is it like threading a needle? Like it's such tiny work. How do you, like, the dexterity in your hands? I mean, obviously you're trained for that kind of thing, but...
It is super tiny. I wear magnifying loops to make everything bigger, make it easier for me to see what I'm doing, and just slow, careful movements. Brain surgery is not something I give a timing on. I know how long a back surgery takes because I do those very regularly, and they're also... there's step A, there's step B, there's step C, and it just kind of flows through those steps. Whereas brain surgery is you go at the speed that it needs you to go. And so, slow and steady wins the race on that.
Would you prefer doing brain surgery on a Great Dane or a Chihuahua?
I mean, it's obviously easier on a Great Dane, right? And you don't have to worry about blood loss on a Great Dane.
Right.
When you're dealing with a 4-pound dog, it doesn't take much blood loss to need to do a transfusion.
Right.
So yes, 100% it's easier to work on Great Danes. And it's funny because I think small breed dogs have more issues than large breed dogs in a neurologic sense anyways, in my world. More disc ruptures, what we were talking about with the atlantoaxial luxation, and yet small breed dogs tend to live so much longer. It's not uncommon to see a 15-year-old Chihuahua.
Right.
So
I wonder why that is.
Yeah, I don't know.
Everything. So I have a Shih Tzu, 15 pounds, and what I have noticed is that everything's cheaper because he's smaller.
Yeah.
So maybe that has something to do with how long they live. They're just smaller. It's less stress.
I think it's less strain to their whole body.
Right.
Great Dane has to pump, their heart has to pump through their entire body. I don't know.
It's interesting.
Yeah.
Something we talked about before the show a little bit. What's the strangest animal you've ever seen?
So probably the most interesting, strangest animal was a tiger cub. It was 12 weeks old and it was bitten. And from that bite wound, it developed tetanus. Tetanus is a problem with the muscles where all of the muscles, because of the toxin in it's Clostridium tetani, is the name of the bacteria, and that toxin that it's released causes the muscles to go into very rigid extension. It gets called lockjaw because it also locks down the muscles in their face, and they get some classic, it's called a sardonic grin. Their face gets pulled back, their ears are often kind of pulled back, everything's all tightened up. That means they can't eat or drink or stand or walk,
wow.
and so you have to put a feeding tube in and support them past that. So we had this tiger cub in hospital for about 2 weeks until it got past, and you treat the infection with antibiotics, but you still have to get the toxin cleared from their body, and so it takes a while for them to get better. But it was pretty cool to nurse that cub back. And actually not that long ago I looked up on the website and he's still entertaining everybody.
Oh, wow.
So it was really cool.
Oh, that's awesome. So, okay, what's the biggest difference between a big cat like that and then just your regular everyday cat?
Well, thankfully, this one was young enough that we don't have to deal with the biggest difference, which is a bite from a regular everyday cat can cause infection. And yeah, that's dangerous, but usually we've got amazing antibiotics and we can treat that, whereas a big cat can kill you in one bite.
Casual.
Otherwise, honestly, the anatomy is the same. And I don't know if you've ever gone to the zoo and watched them play with toys, and you're like, wow, that looks just like my cat at home playing around. It's just their toys are a little bit bigger.
Right. Probably a little more muscle going on in the playing.
Yeah.
So thinking back on what we've talked about so far, and just being around the hospital and hanging out in neurology, I've noticed that you guys mostly see dogs. Mm-hmm. What are the kinds of things you see in cats if you do see cats?
So cats, I would say, tend to be healthier than dogs, first of all, and that's probably why we see more dogs than cats. I think a lot of that is most of our cats are going to be, street cats, and so natural selection will have chosen for the best genetics, and the chances of cats getting issues is just lower. Probably the most common disease I see in cats is more common in purebred cats, and that's called FIP, or feline infectious peritonitis. That's a disease from an infection from a viral organism, and it can go to either their chest and belly, which would then go to internal medicine, or it can go to their brain. That's called the dry form of FIP, and can cause things like balance system problems, dizziness, trouble walking, and it's a disease that's had a lot of research. It's caused by a coronavirus that's not the same as our recent popular coronavirus, but it is actually related to that. And some of the cat research was actually translated to the humans to help us get past the pandemic.
Wow.
Which is pretty cool. And now we're developing some new treatments in animals as well that are giving us some hope for a disease that 5-10 years ago, there was no treatment for FIP. It was a death sentence for cats. Now we've got an antiviral out there that's available that is really promising, is having a 75-80% response rate of cure. We don't have long-term follow-up, so we don't know what the 10-year time is going to look like because it hasn't been out there long enough. But the cats that I've treated so far with it that have responded, so I've treated 3 total cats. 2 of them have responded completely and are doing amazing. One of them, unfortunately, did not respond, and we lost that kitty. But previously, if you'd asked me 10 years ago, I'd say we're going to lose all three cats.
Right.
So it's pretty cool where research has gone with this disease. But that's the most common thing we see in young cats especially. There are a few other infections cats can get. And then older cats are prone to cancer, just like dogs are.
Right.
But the cat brain tumors tend to be more treatable than the dog brain tumors. They tend to be a little bit more encapsulated, and there are times you can actually pull it right out if it's in the right space and the right tumor type.
Interesting. Okay. So what percentage would you say of all of your patients, what percentage would you give dogs and cats?
Over 90% dogs, probably 95% dogs to cats.
So it's a nice little treat when you get a kitty in.
I like the kitties.
Do you have cats?
I do. I have 5 cats now. I just had another one adopt me recently. It showed up on our porch, and 2 months ago we couldn't touch it, and yesterday it was curled up in my lap. So
that's how it goes.
Yeah,
it knows that you are a cat loving person, and that's they have that sense. Okay, so silly question: if you were a breed of dog or cat, what would you be?
That's a tough question. So as far as a breed of dog, I think I would probably be something along the lines of like golden retriever or like one of the retrievery breeds.
Mm-hmm.
Just, loyal and, lots of love in my heart. And so I think I would resonate most with one of those breeds.
Okay. What about a cat?
It'd be great to be a cat. Who doesn't want to be a cat?
Yeah, do whatever you want.
Yeah, I spend half your day napping and then
probably more than half your day napping.
Then go, play and chase toys. My exercise way of exercising is just like a cat's. Like I like the short burst of activity, whereas dogs can go and go and go. No, I'm more of an interval kind of. But as far as I would probably just be a plain old short-haired, domestic short hair, simple. I'm not a put a lot of makeup on kind of girl,
right.
So I think I'd just be a plain Jane, a regular old black cat.
Love it. Oh, love it. Just living your black cat life.
Yep.
I love it. Okay, so reverse a little bit. Tell me about the animals you have at home.
I have a lot of animals at home. So we'll start, I guess, smallest and work to biggest.
There you go.
So I've got 5 cats, as I said before. I have Dahlia, Freya, Thomas, Penny, and now Bandit is the newest one. I've got chickens are always hard to count because chicken math, right? You just never know how many chickens you have. But I think I've got about 15 chickens at home. I have 1 dog. I just recently lost my other dog, but she was old. It was time. She was fighting heart failure and irritable bowel disease, and just reached a point where she wasn't really herself anymore. But she was an amazing little girl. And then my other dog that I have now is Fozzie. He's an epileptic, so I adopted him as an epileptic, knowing what I was getting into. Took my work home with me. He's on 5 pills for his seizure medicine, and then was recently diagnosed with hypothyroidism and developed a blood clot from the clotting. So he's on 7 total pills per day, 7 pills twice a day, I should say, for all of his issues. But he's happy, and he's in the perfect
fabulous
home
for that.
He's such an amazing dog. He's like that loyal, I'll be at your side every moment. He loves the farm dog life too. He loves that he has a dog door and he goes in and out, and he'll just hang out outside and beg for me to go outside, because that's what he wants. Is he actually wants me to just hang out with him outside for hours and hours.
Awesome.
And then the biggest is I have 3 horses. And so I have Scarlet, who I've had the longest. She's 15 years old, and then Goose is 10 years old, and Lilu is 4 years old. So The Scarlet, unfortunately, is not able to be ridden. She injured her low back when she was younger, and we did a whole bunch of stuff to try to keep her going, but we reached a point where it wasn't comfortable for her to have a rider anymore. But she's totally comfortable in the pasture, so she gets to live her best life being a companion to the other two.
That's awesome.
And then the other two are my riding horses.
So do you ride them just for fun, or do you compete them?
A little bit of everything. So I ride for fun around the farm. I take them for trail rides. I fox hunt, and I do dressage competitions.
That's awesome. What's a dressage competition?
Dressage is kind of like dancing with horses. So you have the horse do movements like move off to the side, or lengthen their step or shorten their step, and go through different paces and different patterns.
Wow.
So.
That's exciting.
Yeah.
So on top of everything you do, you also compete horses. You a neurologist, a vet neurologist, you have all these chickens, all these cats, and then also you train your horses to dance. It's incredible.
Yep.
Well, is there anything else you want people to know about veterinary neurology or you, or, the best way to take care of their pets?
I don't want to forget to give a big shout out to the neurology team. I have some really amazing technicians. We've got another neurologist, Dr. Lawler, as well, who is incredible. And I could not do it without my technicians. There's no way I'd be dead in the water, and they are incredible, and they keep me going every day. So I want to give them a huge shout out.
Absolutely. They're an incredible team. You guys make a really, really great team.
Yeah.
One of my favorite departments to just go in and sit and say, what are you guys doing?
We always have something interesting going on.
And always some good snacks in there. There's always some snacks going on. I love that for you guys.
Yeah.
Well, thank you so much for being on Soda City Unleashed. Until next time, give your dogs and your cats an extra pet from us, and thank you for joining us.